Good morning, good afternoon rather, everyone. I want to provide you with a further update on Scotland's response to the COVID-19 epidemic. Firstly, I can confirm that as of 9 o'clock this morning, there have been 1,563 positive cases confirmed, which is an increase of 179 from yesterday. As always, we're very clear that these numbers will be an underestimate. A total of 108 people last night were in intensive care in Scotland with confirmed or suspected cases of COVID-19, which is an increase of 13 on yesterday. And it is with sadness that I can report that there have been a further 6 deaths of patients who had tested positive for COVID-19. That takes the total number of deaths in Scotland to 47. Again, I want to extend my condolences to all of those who are bereaved and say once again how grateful I am to everyone working in our health and care sector. Your dedication and commitment is appreciated, not just by me, but by everyone across the country. This afternoon, I want to update you on 3 steps in particular that we are taking to increase the capacity of the NHS during this emergency period. Before I do that, however, it's worth repeating the key central message that helping the National Health Service is right now a job for each and every one of us. By staying at home, by staying apart from each other, we are all doing our bit to slow the spread of the virus, to help the NHS and ultimately to save lives. It is vital that everyone continues to do that. However, the Scottish Government is also, of course, taking other steps to prepare the NHS for the incredibly difficult weeks that will lie ahead. The Cabinet Secretary will provide more detail on some of these in a moment, but I want to update you on 3 measures in particular. The first relates to hospital capacity, the number of beds that we have available in Scotland. And I can confirm today that following exploratory work over last week and the weekend, we have now taken the decision to start work on turning the Scottish Exhibition Centre in Glasgow into a temporary NHS hospital. If needed, we expect that the hospital could become operational within a fortnight from now. Initially, it will provide us with 300 additional beds, but ultimately it could have capacity for more than 1,000 patients. It is worth, and indeed it is important, to be clear that we might not need to use the Exhibition Centre. There are currently approximately 13,000 beds in NHS hospitals across Scotland, and using those, NHS boards are working to ensure at least 3,000 beds are available for COVID-19 patients within our existing hospital network. The NHS is also working now to quadruple intensive care unit capacity to 700, and we expect those steps, along with the continued public response to our stay-at-home advice, will be enough to ensure that we have the beds we need. But our judgment, my judgment, is that it makes sense for us to act now to increase hospital capacity further. Preparing the Scottish Exhibition Centre as a hospital is the best option for doing that. The Cabinet Secretary will say a bit more about this in a moment, but I want to stress that this will be an NHS hospital staffed and operated by the National Health Service. The second measure I want to highlight relates to how we prioritise NHS services during the emergency period. We have already required to take some extremely difficult decisions. For example, we have had to suspend elective surgery such as knee and hip replacements to create more capacity within our hospitals for COVID-19 patients. And I can inform you today that we have now also taken the very difficult decision to suspend several NHS screening programmes, including our programmes for breast screening, cervical screening and bowel screening. That decision has been made on the basis of clinical advice from the Chief Medical Officer and a recommendation by NHS National Services Scotland. As you can imagine, this is not a decision that we have taken lightly. However, it is important in order to maximise the ability of the NHS to cope over the coming weeks. The Chief Medical Officer will say more about this in a moment, and further information will be available from today on the NHS Inform website. It's not an easy decision, I want to repeat that, but the balance of risk supports the approach that we are taking. It is, however, worth stressing that if you detect any symptoms of the conditions we would normally screen for, if you notice a lump on your breast, for example, then you should contact your GP immediately. We will restart the screening programmes that we have paused as soon as we can. This is a temporary suspension and it will be reviewed after 12 weeks or earlier if evidence suggests that restarting the programme is feasible. However, at this moment, pausing these programmes is an important way of allowing the NHS to deal effectively with the impact of COVID-19. The final measure I want to talk about today before handing over to the Chief Medical Officer and the Cabinet Secretary relates to recruitment. As part of our wider campaign to attract volunteers, Scotland Cares, we are encouraging medical students and retired health and care professionals to apply for posts working in the health service and the social care sector. That reflects the fact that we will need more people, not simply to cope with the direct consequences of COVID-19, but to keep other services going at the same time. We established a new web portal for recruitment on Saturday evening. In total, and this includes earlier expressions of interest, I can tell you that around 5,000 students or former healthcare workers have now expressed an interest in filling posts. They will be considered according to their qualifications and experience and the sort of work that they will be able to do. But our expectation is that many of them will be offered fixed-term employment. I want to thank sincerely everyone who has already replied. These new recruits will make an important difference to the capacity of our health and care services at this time. And I want to stress that we will continue to welcome further applications. Anybody who is interested can find further information through the readyscotland.org website. The response we've had to that call for applications is indicative, I think, of a wider point. Many people across Scotland are responding to this difficult period by showing a sense of community and solidarity. I've already mentioned the Scotland Cares campaign, as well as enabling medical students and former health staff to help the NHS. It also encourages people to help their communities. And I can confirm that in just 4 hours this morning, since we formally launched the Scotland Cares campaign, we have had 10,000 people registering their interest in volunteering through one of the 3 key strands: former NHS workers, the Community Reserve Volunteer Network that will be coordinated by the Red Cross, and the expressions of interest for volunteering through existing organisations through Volunteer Scotland. I want to thank each and every person who has registered an interest. If there are those out there who still wish to do so, then readyscotland.org is the place to go. I can also confirm that at the end of the first weekend of the lockdown measures being in operation, Police Scotland have indicated that they have served just 25 fixed penalty notices for breaching those regulations. And I think those figures do say something quite important and quite profound. They give us an indication, as I always expected would be the case, that the vast majority of people are doing the right thing to protect themselves and to protect their wider community. People are staying at home except for the very specific purposes such as exercise or buying essential supplies. That needs to continue for a good while longer, and I know that won't be easy for people, but it is vital. By staying at home, we can all help to slow the spread of this virus. We will all help the National Health Service to cope, and we will ultimately save lives. So thank you to everyone across the country who is helping us with those objectives. I'm now going to hand over to the Chief Medical Officer to say a few words, including a few more words about the pause in our screening programmes, and then I'll hand over to the Cabinet Secretary for Health.
Thank you, First Minister. Once again, the figures of people infected with coronavirus have risen in Scotland, and as I've said previously, this is a very significant underestimate of the numbers of people who have coronavirus who are moving around in our communities in Scotland. So again, to just emphasise those social distancing measures and only leaving the house for essential food shopping or perhaps to attend a hospital appointment. Exercising once a day, but only doing that within your own household group is also very important to minimise contacts outside your own household. The First Minister has said that from this morning we are pausing the screening programmes in Scotland, and I'm afraid that this was another very difficult decision that we have had to take. It was taken with very careful thought and deliberation, but it's a balance of risks that we believe is worth taking. Our main concern was that people would miss their screening appointments, perhaps because they were not able to attend the appointment, they might have been self-isolating, or because they were choosing not to attend in order not to come in contact with people. In pausing the appointments, we will be able to recontact those people who were due to be screened during this 3-month period and then invite them to attend so that they will not have missed an important part of their health care. We were also concerned that because of staff absences, we would be offering a frail, slightly reduced service, and that again posed some risks for people who were wanting to attend, but we couldn't provide the service. The mobile breast screening vans which travel around Scotland were also not going to be able to be available to be used, as of course this carries a risk with it of transmitting the coronavirus and goes against our own advice about staying close to home. We'll be able to repurpose the staff who are currently running these screening programmes, in particular the staff in our laboratories who can be repurposed to working in our laboratories with coronavirus and helping that vital increase in the capacity for testing for coronavirus that we need. We also are very aware that there are some risks. We would be asking people to travel to attend for screening. They would be coming in close contact with others that in order to have the screening examination carried out, and that on this balance of risk, a pause to the screening programme we feel is the best for the health of the Scottish population. We recognise people will have many detailed questions. The NHS Inform website has a large range of answers for people, and we've also set up a dedicated helpline for people to call specifically with screening queries. The staff there have been trained already and are available on that helpline number for people to phone them and get bespoke advice about their own situation. Finally, I would like to emphasise that people should really watch out for the symptoms that we would be screening for. If people have symptoms, again, there's a detailed list on our website. Please attend your GP or phone the NHS 111 line if it's out of hours, in order to discuss whether these symptoms are significant. And of course, we will see people with symptoms within the NHS as soon as possible. I would just read the different screening programmes that are paused, just to be clear. We're pausing breast screening, so that's mammograms, cervical screening, smear tests, bowel screening, that's the home testing kits, abdominal aortic aneurysm screening, which is an ultrasound of the abdomen in men, and diabetic retinopathy screening, which is the images that are taken of the back of the eye in people who have diabetes. It's important to say that pregnancy and newborn screening will continue as is planned at the moment. Those programmes are unchanged, so pregnant women and newborn babies will continue to be screened going into the future. There is no change to that programme.
Okay, thank you, Chief Medical Officer and Cabinet Secretary.
Thank you very much, First Minister. We all know that there are a number of steps that we need to take to ensure that our NHS in Scotland can cope with the additional demands that will be placed on it as a result of COVID-19. The first of those is what we all can do, and that is abiding by those measures of staying at home, social distancing that First Minister and CMO have outlined. Secondly, by maximising the capacity of our existing NHS estate to cope with that additional demand. That is ensuring we have those 3,000 beds set aside for COVID patients, doubling our ICU capacity, both of which have now been achieved, and going further in quadrupling our ICU capacity, the plans for which are underway. And the third step is to maximise the capacity we have to treat patients beyond our existing NHS estate. And that is why we have taken the decision to establish that temporary hospital at the SAC in Glasgow. The SAC has been assessed as the best option given its accessibility, its close proximity to hospitals in the west of Scotland, the security and its established infrastructure and transport links. It is important to emphasise that this will be a hospital staffed by the NHS with full clinical and medical infection control standards. Joe Young, the former Chief Executive of the Golden Jubilee Hospital at Clydebank, has been appointed Chief Executive of this temporary hospital. And as the First Minister said, the first tranche of around 300 beds will be in place in the next fortnight, with the potential to raise that to beyond 1,000 additional beds. We've engaged with the Army in planning this project and in the support work that they can offer us to get the facility up and running. And I'm very grateful to them for all the help that they have given us so far and will continue to give us. Army staff are also working with us and the NHS to support logistical planning and our response overall to this particular crisis. As I've said, all of this is just one part of our work. And finally, I want to offer my personal thanks to all those nursing, midwifery and allied health professional and medical students who've come forward offering to help ensure that our workforce is resilient, and all those retired medical and nursing professionals who've already stepped forward offering to bring us their skills and expertise in what is truly a national effort to ensure that we cope with everything that the coronavirus brings us, and we maximise our NHS capacity to treat patients.
Okay, thank you, Cabinet Secretary. I'm going to take questions now. Today, all of the journalists participating in this briefing are doing so remotely in order that we are complying with the social distancing guidance. So I have a list of journalists that I will call on to ask questions and keep my fingers crossed that the technology works. I'm going to first ask Peter McMahon of ITV Borders to pose his question. Peter.
I hope you can hear me.
Yep.
My question is to the Chief Medical Officer, if I may. Last week, when you were establishing the expert advisory group for Scotland, you said you would see if you could perhaps relax some measures in Scotland. Perhaps the Scottish population might be reacting differently. Now, everyone accepts London is different, but could that not potentially cause problems? Because is there any evidence, for example, that the coronavirus is having a different effect in Dumfries and Galloway as it is in, say, Cumbria?
Thank you, Peter. I think to be clear, when the announcement was made about the very stringent suppression measures that we have introduced, that we would be reducing that, we would be reviewing those measures and the effect that they have had in 2 to 3 weeks, 2 to 3 weeks, I'm looking at Peter on the screen. So we will take across the country, Peter, looking first of all at those data that we already know with the numbers of people infected. Our community surveillance will be much more accurate in 2 to 3 weeks' time, and obviously we'll have those increasing numbers of people in intensive care. So we will have a much clearer picture of not only in Scotland but across the rest of the UK in 2 to 3 weeks. That review of those measures is to look at, they have been introduced in a slightly staggered form, so the schools closing and then the more stringent measures for the rest of the population, and what difference has that made to the transmission of the virus. We are expecting a peak of the virus in around 2 to 3 weeks, so I would be pessimistic that there would be any change to these very stringent measures. The reason for the scientific advisory group being called for Scotland is to make sure that we have those data available to us in the best form that we can. It will be very interesting to see how the Scottish population responds, particularly as these measures are going to be in place for several months. And it's those sort of data that we will be looking at very closely. Perhaps if people are becoming more relaxed about their social distancing, it might be that we would have some targeting of specific groups of people to reinforce the message, or perhaps if there are people in vulnerable groups not getting the care that they need, again, those data will be extremely important and have a bespoke solution for Scotland. I absolutely agree with you that something that looks like it's different on one side of the border than another is not going to be as specific as that. The virus does not respect borders.
Okay, thank you. Peter, can I go to Louise Scott from STV?
Thank you. I'm wanting some more details on how the temporary hospital will function. Will it be simply for COVID-19 patients? Will it have an ICU facility? And also whether there'll also be a morgue facility in the SEC. If so, what capacity will that have?
Okay, Obviously, we, as the Cabinet Secretary said, we've appointed Jill Young to be the Chief Executive. So in terms of exactly what kind of patients, and it will be COVID-19 patients certainly initially, but what stage of the illness that these patients would go to this hospital, these are the issues that we are considering carefully at this time. But I'll ask perhaps the Chief Medical Officer to say a word more about it, and then the Cabinet Secretary if she's got anything to add.
Thanks, Louise. We've been obviously watching the data I've just discussed, looking at our intensive care beds. We have still plenty of capacity in intensive care across our NHS at present. That situation will change, but we're doing some very detailed modelling of the types of beds that we're likely to need so that this new facility is kitted out with the appropriate level of equipment. All hospitals require all sorts of support services around them. Those support services would be diagnostics, so laboratories, and also radiology, perhaps to do some imaging so that patients do not need to be moved from that facility. Hospitals also would always have a mortuary, and we will be considering all of these aspects of this new facility with our data that we have at the moment, but also projecting into the future numbers that we're expecting to make sure that we get these numbers right and that the facilities are appropriate for the needs of the NHS in Scotland.
The only thing I'd add to that, First Minister, is having taken all of that data that the Chief Medical Officer has outlined and the clinical advice, then you look across the whole NHS estate and work out how best to use all of the facilities that we have for the maximum benefit of patients. And that would now include looking at this temporary hospital and how best to make use of what it will bring to the NHS effort.
I think the final point I would make here is one I covered in my opening remarks. It is entirely possible we will not have to use the additional capacity that we're creating at the exhibition centre. We are taking this decision now because we want to take all of the decisions to cope with and respond to COVID-19 on a precautionary basis. We want to make sure that we have all of the capacity that we could conceivably need. But our focus is very much on making sure that we are maximising capacity, both general hospital capacity and critical care intensive care capacity within our existing hospital network. So this is a contingency that we are creating for all of the sensible reasons that people understand. But it may be that we do not have to have patients admitted to this hospital in the weeks to come. Can I go now to Lisa Summers from the BBC?
Hi. Yeah, I would like to ask a little bit about the Chief Medical Officer yesterday talked about 13 weeks of strict measures. We've heard that life might not return to normal for 6 months. Is that something that you agree with? And if that is the case, then do you worry about complacency?
Well, I obviously take that advice from the Chief Medical Officer and indeed from the other experts that are advising us on the likely behaviour and spread of this virus and the potential longevity of the measures that we've introduced. And we have always been very frank and open that these measures are not necessarily going to be in place for a short period of time. And, you know, if you cast your mind back a week or so, when people were saying, why have you not done X already, why have you not closed schools already? One of the reasons that we wanted to be very clear about the timing of these measures is that we always understood that they potentially require to be in place for a very long period of time. So this period of 13 weeks has always been one we've understood, and clearly we keep that under review as we understand more from our data about the infection and how it is operating. In terms of compliance, you know, yes, of course, it is a concern that as people find it tougher, as they will with every day that passes right now, to comply with these very restrictive measures that we're asking them to, then that gets harder, and it may be that people feel that they relax a little bit in that. Now, we now have enforcement powers, the police now have enforcement powers, which will help us to ensure that these measures can be complied with, but it becomes all the more important that we continue to set out very clearly for people the purpose of these measures. I say openly, I've said it before, I will say it again, I do not want, as First Minister of the country, people to have to comply with these very restrictive measures for a single day longer than is necessary. I want us to get back to normal in this country as soon as possible. But I'm absolutely clear in my mind that we have to keep these measures in place for as long as is necessary to protect the public from the full impact of COVID-19. And that means slowing down the spread, protecting the NHS and saving lives. And for as long as we judge, based on expert advice, that that is necessary, then these measures have to stay in place. And I and others have to ask the public to continue to stick with them. Chief Medical Officer, do you want to say any more about the potential time frame that we're talking about?
I will just briefly thank you, Lisa, for your question. I think we have all seen this graph with the rise of the number of cases reaching a peak and then reducing again. It's that modelling that has led us to talk about this prolonged period of at least 13 weeks, where the suppression measures, the population reducing the spread of the virus is needed. One of the difficulties is that in being transparent and open with people, which I absolutely think we should be, is that long period of time needs to be explained. And it is absolutely because of the incubation period of the virus, of the length of time that people will be ill with the virus if they are going to become significantly unwell, and also in our seeing that the number of transmissions of the virus reduces very significantly before these measures could be lifted. I do agree with the second part of your question about life not returning to normal, perhaps for an even longer period of time. What we do know is that once restrictive measures are lifted, we will see a spike in the number of cases with the virus again, and a spike in hospital admissions, ICU admissions, and deaths. So it is entirely possible that having lifted the measures, we would have to place them back down again. Perhaps not all of them, perhaps not as stringently, depending on the size of this second peak. So I would want people in Scotland to be aware that actually this 13 weeks is one figure and seems a very long time, but unfortunately, unless we really have got this virus under control, we may not be able to return to normal even after that.
Okay, I'll now go to Craig Payton of Press Association.
Hi, First Minister. Thank you. In the last hour, the Royal College of Physicians has come out and said that 1 in 4 doctors in the country are currently self-isolating, either having the disease or knowing someone who does. Is that a statistic that matches what we're seeing in Scotland as well?
I've not seen the particular information that you refer to. Obviously, we're monitoring absence levels in the NHS very closely. One of the reasons we've been encouraging senior students and retired healthcare workers to come forward to volunteer their services is because we know we will have a level of absence in the healthcare workforce which reflects absence rates and illness rates across the general population, and we will monitor that on an ongoing basis. It's one of the other reasons, and this is an issue we've returned to and will continue to return to at briefings, is why we are seeking to expand our testing capacity so that we can test more key workers in the healthcare workforce, so people are not self-isolating unnecessarily. And I think I touched yesterday on some of the work that we're doing to expand our testing capacity, and that work is ongoing. Chief Medical Officer, I don't know whether you want to comment more on any evidence we've got of absence rates right now in particular parts of the health service.
I haven't seen our number of doctors specifically, but our predicted numbers were to be between 17 and 20% of our workforce off at any one time. So perhaps that figure does chime with that. We have put out via the General Medical Council a call for doctors who retired or who have relinquished their licence to practice with the GMC in the past 3 years. That call went out just last Friday, and 1,200 doctors in Scotland have already been in touch to say that they want to regain their licence to practice to come into the NHS in Scotland to work. We are expanding that pool of doctors that are being asked to consider returning to work, so that because of these predicted and known absences, we can fill the gaps, and we have people working with the GMC from today to plug those gaps where they're needed in our Scottish hospitals.
Okay, thank you. Fraser Knight from Global Radio.
Hi, First Minister. Today we've heard from Dr. Kate Broderick, who's working on a vaccine, calling for more funding from other countries in the world to help with their research. Now, they've said in December they hope to have 1 million doses ready for use, either through emergency use or for further trials. I was just wondering how likely we think we'll be ready for using the vaccine by December. How hopeful are we that will be ready by then?
I'm going to hand over to Chief Medical Officer. What I would say is we're all extremely enthusiastic for any and about any news around the development of a vaccine. Clearly, all of us hope that we will have a vaccine ready sooner rather than later, but that enthusiasm always has to be tempered by realism in terms of the timescales associated with developing, testing and getting a vaccine into general patient use. I know there are some heroic efforts underway right now, which all of us want to do everything we can to support and to encourage. The Chief Medical Officer will say a bit more about suggested timescales. I certainly think it's important, while we hope to see this as quick as possible, we have to be realistic about the timescales, and perhaps December, certainly based on everything I've heard, to have a vaccine in general use, I think would, unless the Chief Medical Officer is about to tell me otherwise, be a bit over-optimistic.
Thank you, First Minister. Craig, this is exactly one of the work streams that the new Scientific Advisory Group for Scotland has been tasked with looking at. We've asked them to look at antivirals, so drug treatments that are currently being trialled, and to make sure that Scotland is part of those trials, and also to look at where vaccines are being developed. There is a group in Scotland led by Kenny Bailey from the Roslin Institute, which is already recruiting patients on a UK-wide basis into trials of vaccines. So this Kate Broderick revelation about the speed at which the vaccine might be available, that scientific advisory group will look into that and make sure that Scotland is part of any trials or development of vaccines, not just there, but if there are appropriate trials across the world.
Okay, Vivian Aitken from the Daily Record.
Good afternoon. If I may, I would like to ask a couple of questions. First of all,
well, if you can maybe stick to one, Vivian, because I've got a long list of people.
Okay. Well, if I could ask the Chief Medical Officer, the numbers that she quoted last week, estimated numbers of people who have coronavirus, 65,000. I just wondered how many of those have actually recovered from coronavirus. What percentages of people are getting better? How many people have recovered and moved on? And do we have specific figures for the 1,563 who are confirmed as having coronavirus?
Thanks, Vivian. So we aren't testing people at the moment, so it would be impossible to know specifically who had the virus at what stage and whether they were recovered. But what we can look at is those 80% of people who will have mild symptoms. Those people we would expect to recover within a week. So those numbers that I've talked about, of those people who had the virus at that stage, a week later, the vast majority of them will be either fully recovered or well on the way to recovery. It's important, however, though, to note that those people recovering are being replaced by more people who are getting the infection, and as I've said before, are doubling time, so the number of days in which the virus will take to double in the population is around 3 to 4 days. So if you take figures I was quoting 3 to 4 days ago of around 50,000 people, then it's more than 100,000 people in Scotland that have this virus by today.
Thank you. Tom Martin from the Daily Express.
Good afternoon.
Sorry, we're not hearing you, Tom.
Can you hear me now?
Yep.
Hi, good afternoon, First Minister. Thank you. Just very quickly, Professor Neil Ferguson from the Imperial College has suggested this morning that there's some evidence of the virus slowing down based on hospital admissions. I just wondered what the picture, is there a picture of that being experienced here yet?
Do you want to take that?
I haven't seen Neil Ferguson's report this morning. I do know that there was a modelling group that was meeting this morning. We expect to have a readout of that group this afternoon. Again, our scientific advisory group, chaired by Professor Andrew Morris, has been tasked with looking at those Scottish data for us. So I haven't got it at the moment, but certainly if we do have a change in the rapidity of spread of the virus, we will come forward at these press briefings and let you know.
We've always been very clear, and the Chief Medical Officer's been very clear that it would take a period of time, a couple of weeks, to see the effect of the measures that have been introduced. So we would hope that these measures, because the purpose of them is to slow down the spread of the virus, but we would be quite cautious, I guess, in terms of when exactly we would expect to see that materialise. Simon Johnson from The Telegraph.
Hi, First Minister. I was going to ask, of the 1,563 cases, do we know how many of these the person acquired the infection while in hospital for another reason? And what are you doing in terms of surveillance and recording hospital-acquired COVID-19?
Okay, I'll hand over to the Chief Medical Officer, who we're not breaking down at this stage that figure in terms of where the acquisition of the virus was, but the Chief Medical Officer may want to say a bit more about hospital-acquired infection.
Yes, so these nosocomial infections, those are acquired within a hospital setting, are very important to map the spread of the virus within a closed community. We have asked that all ICU cases who have coronavirus, that virus is genotyped so that we can see the specific genetic makeup of that virus and compare that with other people who are infected in that hospital setting in order to track whether the infection has come from a particular person. Our hospital admissions are all also being tested for coronavirus, and we will, with appropriate symptoms at the moment, but we will expand that testing into more hospital admitted patients. So we will get a clearer sense in the next week or so of exactly what you're asking, what the spread in the community is, but also to be very clear about spread within that hospital setting. Of course, we are very aware of the risks that our healthcare workers are putting themselves forward for within those hospital environments in looking after these patients. And they at the moment have their protective equipment. They understand what level of equipment is needed in order to keep them safe. And you'll have heard us reassuring the healthcare worker population that we have those supply chains of that protective equipment absolutely streamlined so that they have the right equipment to use in the right hospital setting.
Thank you. Tom Peterkin from the P&J.
Good afternoon, First Minister. We know that health professionals are very keen for testing on frontline workers to be rolled out as soon as it can. Can you give us an update on how many have been carried out, how many are planned, and by when, and how are we doing compared with the UK? And finally, what would you say to people who feel that there hasn't been enough, or there aren't enough of these frontline worker testing being done yet?
Well, we are testing as many people as we have capacity for, and we are in the process of ramping up the capacity. At the outset of this, when coronavirus started to spread, I think I recall saying that we had capacity in our existing labs for just under 800 tests a day. We are taking steps over the next few weeks to build that up to 3,000, and we hope to go beyond that. I can see yesterday the NHS carried out around 1,200 tests. I think it's important to be very clear. Well, firstly, that would not all be on healthcare workers, obviously that is in total, but that does not necessarily equate to 1,200 people, because some people require more than one test. And I think the number of people that were tested yesterday was just under 800. So that's the figures at the moment. But we are very focused, and a huge amount of work is underway right now to expand the capacity of our lab network in Scotland so that we can do more tests, and that will obviously enable more tests of key workers to be done. There is guidance that has already been followed in terms of the prioritisation of testing for key workers right now. That's the position in terms of our NHS testing capacity. There are further discussions ongoing on a UK level about being able to expand through some commercial partnerships testing beyond that, and we have an additional lab in Glasgow that is able to be operational within the next couple of weeks as part of that. So getting testing capacity increased as much as possible is one of the key priorities we're working on right now. Do you want to add anything? Okay. Michael Blackley, Daily Mail.
Hi, good afternoon. I'd like to ask regarding the issue of enforcement. You mentioned the figures from Police Scotland that there were 25 fixed penalty notices over the weekend. Would you like to see police continue to be quite strict on this issue? There were a lot of reports over the weekend of people driving to public places. Would you like to be seeing police seek out these people and issue them with fixed penalty notices?
I would like to see, and I think we have seen, and I have every confidence in the police to conduct themselves in a very proportionate and sensitive way. These are difficult restrictions that we're asking people to comply with. So what I want to see more than anything, and what I think we are seeing by and large, is the public voluntarily complying with the advice that they have been given. I have always said, and I hope it will be the case, and I think the figures for the weekend bear this out, that the police will not be required to use these enforcement powers very much at all, because people are, by their own volition, doing the right thing. And I think, generally speaking, that is what we're seeing, and I'm hugely grateful to people for that. But it's important the enforcement powers are there, because even if there is a minority of people who are flouting these regulations, and that poses a risk to the general public, and it poses a risk to the ability of our NHS to cope, and ultimately it does put lives at risk. So I would repeat my plea to people to continue to do the right thing for your own sake, for the sake of your own loved ones, but also for the community and for the National Health Service. And that's what I want to see in terms of how these measures are complied with. Scott McNabb of The Scotsman.
Yeah, First Minister, I wanted to ask about the legislation you're passing this week in Parliament, particularly a bar on landlords from evicting tenants during the pandemic. I wonder if that's something that's been flagged up to you as a particular concern, maybe from campaign organisations.
I covered this at the briefing yesterday, so we will publish the emergency Scottish legislation tomorrow. It will be considered by Parliament on Wednesday. We intend to have a bit of a focus at tomorrow's briefing on the contents of the legislation, and Mike Russell, the Minister who's steering it through Parliament, will be here to answer more detailed questions. But on the issue of eviction, I made clear that the legislation will cover that, and it will take legislative steps through extending the notice period that landlords have to give before they can evict somebody. It will effectively mean that nobody can be evicted during this emergency crisis period, and I think that is absolutely right. Many people will be falling into very difficult financial circumstances because of the response to COVID-19. And while there is a lot of help available, it may not be available for everybody immediately. There's waiting times for universal credit, for example. Some of the business support, understandably, takes a little bit of time to come on stream. So it's really important that we give people the support that they need, and that's why the legislative measures that we will announce tomorrow, and you'll be able to see them in the bill tomorrow, make it very clear that we would not think it acceptable for anybody, private rented tenants or social rented tenants, to be facing eviction and losing their home during this period. Right, and I think lastly on my list of people who had indicated that they wanted to ask a question, I've got Phyllis Stephen from the Edinburgh Reporter.
Hi there. You can hear me. First Minister, good afternoon. A couple of my questions were already asked. I wanted to also ask, are any steps planned for checking those arriving into our ports and airports from abroad, perhaps by thermal imaging?
I'm going to hand over to Chief Medical Officer on this, because she will be able to give a much more expert answer than I can. But this is a question that has come up regularly, and the advice has always been that checks of that nature in that way are not reliable in terms of the numbers of false positives or negatives that they can throw up. But I'll hand over to the Chief Medical Officer, who can say a little bit more about the reasons for that.
We had considered this very carefully some time ago when there were reports of some countries using thermal imaging or temperature checks at borders, airports and ports. The fever that comes with coronavirus is not in everyone. So the difficulty is that you can be falsely reassured by somebody's temperature being normal, and they have coronavirus, they have other symptoms, but they believe they haven't, and therefore don't take measures to restrict who they transmit it to. The other issue is that we would pick up a whole lot of different conditions which have given somebody a fever. And of course, with our health service being as it is, we're trying to protect the capacity of the NHS, we would then have lots of people potentially contacting where they're not very unwell, but they've been picked up as having a high temperature, and the increased demand then on the health service is something that we're trying to avoid. All of these tests, we want them to be both sensitive and specific, and unfortunately a raised temperature is neither sensitive nor specific enough to be something that we would use as a screening test for coronavirus.
Okay, can I thank you all very much for joining us remotely today, and thank you to everybody watching at home. I would say repeat advice that the Chief Medical Officer gave. If there are any members of the public who have questions or concerns about the pause in the screening programmes we've announced today, please go in the first instance to NHS Inform website, where many of these questions can be answered. If there are further questions from the media, we're keen to seek to answer them over the course of the day. And tomorrow we'll do a further briefing where we'll cover a range of issues, but we'll focus in particular on the emergency legislation and the content of that that I've already talked about today. But for now, thank you all very much for joining us.